Yes, you're still with us here, and see, the story is still with dermatologist Dokter Alfonsus Rendy Laksditalia. So we are still talking about vitiligo. Doctor, what treatment options are available for vitiligo aside from, let's say, the ointment and stuff?
Okay. So basically, the mainstay therapy for the vitiligo is, first one is the topical. The cream is actually still becoming the first line. So either the corticosteroid, the calcipotriol, and also leukotriene inhibitor is still the first line for the vitiligo.
You can even lie to me about those names and I wouldn't know.
So first of all that, and the second one is now we have an excimer laser. So it have the ultraviolet B, that giving the lights in your, it's kind of giving the lights in your skin to make sure the repopulations of the melanocytes. The third one is the PUFA. PUFA is the Psoralen. It's a topical also. Topical is a cream that you apply, and then you put in an ultraviolet A with the sun exposure, and then it will come back again. The third one is the surgical. The surgical.
Wow.
Yeah, so we take the skin, our normal skin, and then we cut out the vitiligo part. Sometimes the one that persists to the therapy. Sometimes, so we cannot give one therapy for vitiligo. We cannot only give ointments, or we cannot only give the excimer laser, but we need to do the combinations, right? But sometimes when we do the combinations and they persist, they are an optional of doing the surgical excisions from the normal part of our body, and then put it in the area of the vitiligo. But we cut the area of the vitiligo first, and then plant it or graft the skin in there. That usually done by the plastic surgeons or a dermatovenerologist like me, but who have a main in the surgery or the dermatosurgery.
Wow, that's pretty serious. You know? Okay.
It was surgical even.
Yeah. All right, so doctors, what factors can worsen vitiligo, and can exposure to certain medication aggravate the condition?
Okay, so first...
I mean, like the therapy, does it work all the time, or sometimes, like allergies or something happens and then you just have to stop the therapy?
So things that makes vitiligo worse, like I said, is the environmental factors. First of all, be careful to the sun exposure, because as you know, the sun have an ultraviolet A, B, and C. And also there's a radiation. There's a theory that in the literature that said that the genetic mutations can happen due to the decrease of the antioxidant in our skin. So when you get sunburn and then increases of the radical oxygen species, and then happening is the oxidative stress, it makes the vitiligo worse. That's the first one. Second, there's a Kupner phenomena. So if you have a scratch, probably a trauma, sometimes a chemical exposure to your skin, it can also destruct the melanocytes, because our immune system detects it as a harm, and then they releases the cytokine and everything that may destruct the melanocytes and make the pigmentations happen. But it's only happen if you have a susceptibility for vitiligo. If you don't have it, probably it's not going to happen to you. But when people have the susceptibility, that may happen.
Okay, now let's say a person with vitiligo got the condition all over the body, or some patches and stuff like that. What is the not treatment, but this, because with vitiligo, they have no barriers for the sun, right?
Yeah, you said no umbrella.
Yeah, no umbrella.
Yeah, the no umbrella things I like to say.
What's the worst thing that could happen with people with vitiligo when it comes to the sun exposure?
As you know, if you know about the sun exposure, the darker the skin, it means the higher melanocyte levels, right? It means that is why the tropical country, usually people have a darker skin, rather like in the Iceland or probably in the snowy atmosphere. That's happened because the more increase of melanocytes, it means it will protect you from the sun exposure. So without the melanocytes, it means you have no protections to your skin, and it's increasing the risk of having a skin cancer or probably sunburn.
So that's the even more
advanced problem. that may
dangerous,
cause,
advanced problem.
No, doc. I mean, vitiligo happens to women too, as we know. So, can they still use skincare, or are there any skincare that ingredients that need to be avoided?
Okay, first of all, Yani, the most important things with vitiligo patients is they need to communicate with the dermatologist to make sure that the skincare doesn't worsening the vitiligo. First of all, we cannot say every skincare is safe for the vitiligo, but the skincare with high acidity, the active ingredient, like acid, retinoic acid, mandelic acid, everything with acid, sometimes can cause inflammations in our skin. Actually, it's not the acid that give problems to the vitiligo, but the inflammations. If they happen inflammations, any inflammations, whether it's a traumatic inflammations or probably skincare inflammations because too much active ingredients, it will provoke this vitiligo to happen. Because vitiligo can be provoked by the inflammations in our body. So make sure the inflammations are less in your skin, so it's not happen the Kupner phenomenon that I said before, and then make the patches happen.
Things, right? I see. Okay.
And also the laser. You need to be careful with the laser, especially the depigmenting laser. A lot of skin clinic now have laser to brightening the skin. Yeah, make sure you consult your doctor really well because the laser, we need to make the skin brighter, right? Sometimes it causes also the inflammation.
I did that.
And also, if you have a white patches, so you go to the doctor to make sure, is it a vitiligo or only a normal white patches that happens because of the laser, or is it an allergic conditions that have a white patches? Because not all white patches is vitiligo.
Okay, now we hope that our conversation with Dr. Rendy would bring even more light to your understanding about vitiligo. So it's not a disease, it's a condition. Now, it is our tradition to wrap up the interview session with playing games. This time around, it will be the myth or fact game. So Yani, this is your board. I will read the statement about the theme, then me and Yani will guess whether it is a myth or a fact, and Dr. Rendy will give the right answer and explanation afterward. All right, so can we have the first statement on the screen, please? Let's see, myth or fact? People with vitiligo should not get tattoos.
Oh, we didn't talk about this. I don't know.
Okay.
Who likes tattoos?
I feel we both.
We both like tattoos. Okay. You need to guess, right?
We're gonna guess,
right?
You need to
guess first.
I'm gonna say myth.
Yeah, I'm gonna say myth too.
Yeah.
Because we did not talk about this.
Yeah.
All right, doctor, is it a myth or a fact?
So, it's actually very debatable, like you said, because there's sometimes when people have vitiligo, they want to have the tattoo to
cover the vitiligo.
The vitiligo.
The patch.
But however, you need to talk to your doctor whether the patches is stay in that shape or is it increasing by size. Because sometimes you make probably a tattoo, a dragon tattoo to close those patches, right? And then it's getting bigger. It means you will still have the tattoo around those things. As a medical practitioner, I would say it's actually not recommended to have a tattoo because the tattoo can cause a trauma and it can cause, like I said, the inflammation and may make the vitiligo happens in there also.
Okay, so it's a fact.
So it's actually a fact. We need to avoid...
You want to avoid inflammation.
You want to avoid inflammation.
Okay, so that is the explanation. All right, can we have the second one, please? Tanning can help cover up vitiligo.
Okay, how about that?
That's no,
that's a myth.
Because they can't go out. I mean, they can't go out.
They have no barriers. Myth.
Okay. That's very interesting. That's also a myth, right? Like what you said. Because you're right. Because there's no barrier in there, and the free radical may increases because of the sun exposure. And even there is a therapy that need sun exposure, we cannot have the sun exposure too much because it will worsening the vitiligo. Works like the tattoos.
Yes, yes.
Yeah.
Sometimes we need to avoid the inflammations, and also the tanning can make your skin have a different degradation. We have a darker skin when we do tan, right?
Yeah.
So it tends makes the patches of vitiligo shows up even more because your skin different
Contrast.
Yeah, that's what I want
Making
to say.
even more contrast.
Contrast.
All right.
But you're right.
Yes, we're
Okay.
correct. And
Yeah.
can I have the next one, please?
Yes.
Vitiligo can affect the inside of the mouth and hair.
Oh, we didn't talk about this either.
So much mystery. right?
We didn't say.
Fact, because Graham Norton got the gray hair because of the vitiligo. Wasn't that?
Oh yeah, he said it was on his head and his hair.
Yeah, yeah.
How about that?
But I didn't hear it from him, so I'm gonna say myth. I need him to explain it to me.
So the answer is actually a fact.
Yes.
Okay.
Because there is a conditions, right? The hair, there's what we call as a leukotrichia, the white hair that happens in the vitiligo skin, that actually showing a really bad response to therapy, usually with people with
The hair.
the hair, because repopulations need a fabric of melanocytes. Our fabric of melanocytes is the hair, our surrounding skin also. And also the vitiligo can happen in the genitals and in the mucosa of our oral, mouth mucosa.
Mouth area, okay.
Inside the
Inside the mouth.
mouth.
Okay. Can I have the next one, please? Makeup cannot be used to camouflage vitiligo.
I mean,
It's a
people
myth.
do it all
Yes,
the time.
people has
I mean,
been-
not
been
all the
doing
time, but
it.
people do it, right?
So is it a myth or a fact? Makeup cannot be used to camouflage
That's
vitiligo.
also, you're both right, it's a myth. However, the camouflage is actually one of the choices for the vitiligo patients to accept the condition socially. Sometimes
yeah.
when you have a small patches, a lot of skincare now, especially overseas, that have color tinted with your skin, and then you can use it to camouflage the vitiligo. And it's not worsening the condition, so it's okay.
It's okay, all right.
okay.
So that is actually the last statement that we have, but we want to thank Dr. Rendy. Thank you so much for bringing even more light to this topic.
Yeah,
this
we learned so
vitiligo.
much
And
in just like 30 minutes.
yeah, 30 minutes. And we found out that this is not a disease. This is a condition. It is treatable in some degree, but also this is not something that you need to cautious about when you have your friends or your relatives, your colleagues have vitiligo, because actually there's no difference in function as a human. That doesn't, this particular condition doesn't make you less of a human.
Yeah. No bullying.
No bullying.
Embrace it.
Just embrace it. And thank you, doctor.
Okay.
And we hope that you can come back even more to explain to us even more topics that you might not know of. We'll be back with your daily dose of entertainment on the last segment of the show. You don't want to miss that.